I saw a patient yesterday, and his primary care doctor felt that he had pseudogout. So he's asking, "Hey, doctor, what is pseudogout?" And he understands gout. He knows that gout is because there's a lot of uric acid, and one can't get rid of it. But he doesn't understand this whole pseudogout kind of thing. So my name is Dr. Arinola Dada. I help people with joint pain become pain-free, people with autoimmune disease get their immune system back on track. So when we're talking about pseudogout, pseudogout and gout are similar because crystals are being deposited in joints. So that's a similarity they have. For gout, it's uric acid crystals, but for pseudogout, it's calcium crystals. And you can say, well, how is calcium getting deposited in the joints? So sometimes pseudogout happens because when the body is injured, so let's say a joint is injured, the cartilage gets irritated. And the body only knows how to do one thing. When there's an injury to cartilage or bone, it puts calcium in there. And that is wonderful. When you have a fracture, you actually need the body to put calcium in there. But when there's irritation to a cartilage and your body puts calcium in there, well, calcium is not cartilage. So the body doesn't have a very good way of repairing like cartilage and meniscus. So one may be prone to having calcium deposits there. The problem with calcium deposits when they don't belong in a certain place, when they move or there's some kind of irritation, then your body's white blood cells kind of say, well, what's that? It doesn't belong there. And they go in there to investigate. And when your body's white blood cell goes in there to investigate, it tries to engulf the calcium crystals, just like it tries to engulf the uric acid crystals. And this activity of the white cell trying to engulf a calcium crystal actually triggers off this inflammatory response. And so people with pseudogout have calcium in their cartilage, and so it triggers an attack of pseudogout, right? And the reason they call it pseudogout is because before they figured out that it was crystals, they kind of thought it was all gout, right? But once they figured out crystals and they're like, oh, the crystals for this one is uric acid, then it became gout. And the crystals in this one is pseudogout. So there's certain things that can cause you to be prone to pseudogout. And there are four basic things. So one is your thyroid, whether your thyroid is working too hard or working too slowly. So any abnormality of the thyroid can cause you to have pseudogout. The second thing is your parathyroid. So you have your thyroid gland is bang in the middle, and next to it there are these four parathyroid glands. And those glands actually control how your body handles calcium, whether your body absorbs calcium from the gut or pees it out, or stores it in the storage facility known as your bone. And it also maintains just how much calcium you have in your bloodstream. So we talked about thyroid, up or down. We talked about your parathyroid hormone kind of going out of whack and being too active. You actually have copper in your body, just in case you don't know. And so if you have any abnormality, something called Wilson's disease, where your body doesn't handle the copper properly, then you can have pseudogout. And then the acromegaly. So I don't know if anybody's a wrestling fan, but I kind of think that Andre the Giant had acromegaly. I was a real serious wrestling fan when I was younger because I grew up with 3 boys. So anyway, so Andre the Giant I think had acromegaly, and acromegaly is just like too much growth hormone, right? And then you get very tall and you become giant-like. So anyway, but if you have too much growth hormone when your bones are already fused, then you may just start having more coarse features and you may never be as big as Andre the Giant. So anyway, Wilson's disease, thyroid, growth hormone issues, parathyroid hormone levels, those are all things that can actually affect and increase the risk of having calcium deposits in your joints. How does your doctor know? X-rays will be the number one thing. So X-rays can actually show calcium deposits. Sometimes, if they, fluid can be taken out of the joint. Doesn't sound good, but yeah. Sometimes they put a needle in the joint and they take fluid out of the joint and you analyze the fluid, and that can actually show pseudogout, and it shows the calcium crystals basically. And since they don't belong in the joint, and then I guess one thing that somebody say, well, if I have calcium in my joints, may I stop taking calcium? No, it doesn't really have much to do with with the calcium intake, because you can imagine, yeah, your body has a big store of calcium known as your bones, right? So the big store of calcium that your body has, that is known as the bones, would be where your body would go get it from if you had any of these underlying abnormalities. So, so not every swollen joint is gout, right? So I guess that's it. Not every swollen joint is gout. Don't assume it's gout, because it could be pseudogout. So in that case, your diet doesn't really change it, but your doctor may have some options in how to control and prevent it. But anyway, so my name is Dr. Arinola Dada, and if you're in the greater Seattle area, look us up at overlakearthritis.com, like the video, share it to anybody that you think this may be beneficial to, and subscribe to our YouTube channel, Healthy Joints, Healthy Life with Dr. Dada. Take care. Have a great